As new as the idea of a universal basic income may be, one of the first few truly universal experiments was concentrated in the rural town of Dauphin, Canada from 1974 to 1979. In collaboration with the Department of National Health and Welfare and Manitoba Province, the budget of the experiment amounted to around 17 million Canadian dollars, with the federal government covering three-fourths of the cost. The experiment had two areas, Winnipeg and Dauphin. In Winnipeg, only working able households were chosen randomly to measure work efforts when given a payment. However, on the other hand, Dauphin took the approach to include all households, around 10,000 people in total, as the town's unique isolation would draw out the design for administration of a UBI and assume more accurate overall effects of the payment. This would include the working and non-working population, such as the elderly and disabled. Dauphin paid 4,800 Canadian dollars to every household monthly, which made a substantial increase in income, specifically for those who worked, in comparison to those already on social welfare, emulating the reason where a UBI can still provide incentives to work for a greater personal income. However, the experiment ran into several issues. One, the 1970s was characterized by inflation and oil shocks in Canada, making the price of living higher. As a result, the UBI payments were adjusted for inflation, but the initial funding ran out too quickly and the government focused on the crisis over continuing the experiment. Second, the information collected from the experiment would eventually finalize through observing families/communities and the way the payments were carried out. At the time, social and government support for the experiment decreased significantly, which led to papers containing data to be stored away in boxes. It was only until several decades later when Dr. Evelyn Forget would revisit these documents and analyze the effects using intervention and correlation associated as a result. Forget initially wanted to see how health was changed for families during this time and had to prove the possibility by analyzing the enrollment of 12th graders from the previous year during the payment period. The assumption was that a cushion of income would allow kids to stay in school longer rather than dropping out to work, a very common choice, therefore translating to a community change in various aspects of their lives. As she proved that the retention rate was higher in Dauphin in comparison to control towns nearby, Manitoba Health allowed her to access data retaining patients and hospitals during this time period. In comparison to the control group, hospitalizations in Dauphin at the concentration site fell by 8.5%, equating the control participants. Within the town, hospitalizations also fell by 19.23% for every 1,000 residents. The reason behind these visits were described vaguely as accidents and injuries. This is due to the familiarity of residents in the small town, which also removed specifics other than discharge records, physician claims, and vitals of patients collected during the period of cash transfers. Perhaps such familiarity removed anonymity that would allow for detailed written records of reason of visit, especially in Dauphin, where most residents worked in farms and had physical work. Hospitalizations would be a dire resort after considering medical expenses and income foregone from not working. A basic income would allow families to not be pressured by their unstable salary due to the nature of work. Regardless, the overall increase in education retention rates and decrease in hospitalizations proves to be a community effect, as a greater income allows for less risk relating to personal savings and lack of income, encouraging examples such as children to go and finish school together. For these types of studies lacking initial analysis, many aspects of the lives of individuals, from education to work to health, needs to be evaluated in conjunction to be understood in separate categories, which proves to be complex and intricate in nature on how people live their day-to-day lives.